Actually, I was walking in the steps. I thought I might ask, like, what intrigues me, I guess, is privilege and how privilege works, and how we get silenced in different contexts. And so what I was asked to sort of address is who I am as a gay man in my work life, and somehow how that overlaps in my personal life as well. So, Stonewall happened in 1967 or so, and it kind of opened up all this space for gay men and lesbians, and so we all reap the benefits of that. In my life, things have just changed so much over the past number of years. In some ways, I assume that many of the people that are here have thought about this lots, about the privilege of heterosexuality, the privilege of all of that. Charlotte, and I forget her last name, Linda might remember, Byers, do you remember Charlotte's last name? The woman who said, if you want to know how homophobia works, go home and tell everybody you love, tell your parents and your kids and your neighbors and everything that you had a revelation today that you're gay, and that you love guys and dream about them sexually. And or all those things, and see what happens in your life to do something like that. That was one of the first things I remember that was really helpful for me to sort out what was going on in my life around gay and myself as a gay man. So it took me for ages to figure it out. I was married for 18 years. I have children and grandchildren at this stage. But I reaped the benefits of what happened at Stonewall, and that all these changes have happened. The Nova Scotia Rainbow Action Project here has been instrumental around same-sex benefits, all of those sorts of things. And now same-sex couples are marrying and adopting children, and all those things that were unheard of. I work as a clinical therapist in social work in the Capital District Mental Health Program here, and most of my work has to do with gender, and I do assessments for the introduction of feminizing or masculinizing hormones is a big part of my work, but there's all kinds of overlaps if one has schizophrenia or a variety of other things. So that's the main piece of my work. But historically, over the last sort of 17 years that I've been working in that program, I've been able to bring my personal experiences to my clinical practice. And so, even though we all know that there has been such progress for gay men, lesbian women, and a diversity of people who identify these days as queer or a variety of other identities, that there's still tons of trouble. So again, I wasn't quite sure, and I might be rambling a little bit, but hopefully it'll make some sense. I just took some books off my shelf, for instance, so I still see lots of gay men. There's still tons of trouble. That whole thing about being silenced at work. There's no safe place for me to feel that I can talk comfortably about, that I did actually find some guy on the bus attractive in some way, and it confuses me. I'm married with 2 kids, so healthcare without shame is what is like. All the men that I would see, and I guess I'm going to stick to the sort of same-sex attraction, male to male, today, finding healthcare without shame is tremendous. So another book off the shelf, My Husband is Gay, Families and Loved Ones That Need to Deal with, a loved one, dad, or my husband coming out as gay. This book has been great and still stands up. Free Your Mind, in terms of young people coming out to parents, and the language in that is excellent. So, So I hope some of that makes sense. Mostly that's, I mean, I could tell personal stories, but I feel like, again, people must in some ways, we're sort of I'm part of the privileged gay crowd, you know. When I was walking up the steps on my way here and thinking, who will be here? Who are we talking to? I thought I might ask, you know, trying to illuminate this notion of privilege, who in the room has ever had a feeling that they were attracted or had some feelings for someone of the same sex? And then, and not that you need to raise your hands, although that might be interesting. But when I walked in the room, I thought, oh my God, they're all gays here. So that question isn't going to work. But I know you're not all gays. And I know some of you are just old-fashioned heterosexuals. So yeah, I'm not going to talk a lot more about it, other than just to focus on that, you know, it's still a huge issue. And Sibel Reber, our new Pride Health Coordinator, is going to say some things that and give some stats that'll help sort of illuminate it all. And gender's really a huge field that we're all looking at now, opening up big spaces for us, for our gender expression and so on. So Dr. Knudsen is going to talk about that, so I'm going to leave the stage.